And we are good.
Okay, I'd like to call the meeting of the Council on Aging to order, now that we have a quorum of 5 people. And everyone should have received the agenda from Laura a few days ago. So the first thing that we're required to do is approve the agenda.
Roll call. I'll make a motion to approve the agenda.
Oh, we have to take attendance first.
Oh, yeah, you're
So
right.
make sure everybody
Okay.
can hear
And
us,
then I
'cause we
have
got
to read
people
the
up there.
script, so I'm getting this all out of order. Okay, I'm gonna read the script first, and then part of that is taking
We don't read the
attendance.
script at any of my meetings anymore.
They
All I do is make sure everybody can hear us and you know who's here.
there's like there's the 2 points there is like there's like 2 PSA points there. What is it? It's the,
Can we hear?
Okay,
and then you
I
have
guess
to
the
do-
most
I think
important
you're
thing is
supposed
that
to
we
do a
take,
roll call.
Yeah, roll call, see who's here.
roll call is the most important thing?
Yeah,
Yeah.
Okay,
I
So
just hop
that's-
in. At this point.
I'm
all right, please say yay when I call your name. Abby is not here, Rocky is not here, Robert will be late, Aaron,
Here.
Arlene,
Here.
Lisa,
here.
Linda.
Here.
Mary Ann here. Thank you very much. And 2 people from the staff are Jericho.
And
No,
Jericho's here.
Laura, in
And Laura
attendance.
was said she would be here, but I don't see her yet.
I'll make a motion to approve the agenda.
Second. Okay, so I'm gonna have to roll call on that.
Yeah.
We're going to have to go down the agenda, roll call for approval of the agenda. So, Aaron. Aaron, approval of the agenda.
Yes. Sorry.
Arlene,
Yes.
Lisa,
Yes.
Linda.
Yes.
Mary Ann, yes, thank you very much. The next thing on the agenda is.
Bless you.
Bless you. That was a yes.
The next thing is approval of the minutes of the last 3 meetings, which Arlene,
Just the last 2.
no, actually, there was 3 that we don't have yet, but we don't have the minutes yet, so no one has received the minutes and therefore we cannot approve them yet. So
Okay, we'll move on.
we're going to move to the next thing on the agenda today, which are our guest speakers, who just a couple of hours ago said they're going to have to cancel.
Who
So
were they? Oh,
we were going to have Mickey Rowland and
And
Brenda
Brenda.
McDonough
Yeah.
from the Council on Disability. And they're very, very sorry to have canceled, and they will be at a future meeting for sure. As a matter of fact, Mickey Rowland said he'd like to do it in person here in the trailer. So he's off island right now, but they'll definitely be here at a future meeting. So this is gonna be a really short meeting today. I'm sure you're all happy about that. Next thing on the agenda is discussion of the Senior Expo now that it's over with. And before we even talk about it, I'd like to thank everybody. There's a great outpouring of people who volunteered. Erin, Arlene, Rocky, Lisa, and thank you to my co-chair, Linda. So
you did it.
everybody was there and yes, great job. So I'm gonna say a few things about it and then everybody else can jump in. We had hoped for about 200 attendees. We only had 100. So that was disappointing. However, we had some exit reviews from people who took the time to tell us what they thought of it. And then we all heard comments from people randomly, and all of those comments were so overwhelmingly positive that kind of made up a little bit for the fact that attendance was lower than we had hoped. So we've had a meeting to debrief on the whole thing. And anybody who would like a summary of that meeting, just let Laura know and she'll send you a copy of it. But the nice thing is that in sending a thank you note, I was just telling Jericho, I sent a thank you note to the superintendent of schools, Elizabeth Hallett, and I got a reply from her within an hour saying, glad you had a successful event, and you're welcome back next year. And so that was thumbs up to that. So if we have another event, which we're likely to do, we're welcome to use the high school again, which is a good location. So, since everybody participated, practically everybody participated who's here, jump in and give us your summary of the senior expo this year.
Sort of redundant from what we talked about on Monday, but I spoke to every single vendor. I spent time talking to every single one of them. They were glad to be there. The one thing that did come up is that we were gonna try, Jericho, hadn't you heard that yet? To try to get, if they're gonna come and do the COVID flu, yada, 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 that they do it with us at the high school on the same weekend.
I'll try. I can't make promises on that.
So you tell us when they're coming and we'll figure it out on our end. But we just want to see if we can't do what we used to do, which was have it in cafeteria. And everybody got their flu shots and now we've got RSV shots involved. Now we got COVID updates involved. Cause I had to go over to the other school, as you know, after that. So we just wanted to see if there was a way to drive more people there, because when we used to have the flu shots, 10 years ago. With the elder
You
bear,
guys did have the
It
visiting
worked.
nurses doing flu shots
they
there.
didn't get a lot of people because they were down towards the cafeteria and I helped them set up and they were not that jazzed about how few people came because he didn't see them. If people
Yeah.
weren't, they were all going over to the elementary school, so, and Dan's and stuff like that. So if we bootstrap them together again and do it in the cafeteria where we used to do it, that drove people down the hallway, talking to all the vendors and et cetera, et cetera. And it was a big draw. So we'd get that extra 100 or 200 people, because they were jamming over there.
I think they also had quite a few flu doses go out of the hospital one earlier.
Mhm.
And then there have been a few other clinic doses, which is good in the sense that we got more flu doses done this year than the year before. But I think the draw, when it was the only place to get a flu clinic.
And I got the COVID over there.
Yeah, I will definitely, hey Rob, come on in.
Hey, Robert.
I definitely, I will see about placing it in there, but in the past, what we did is we had the elementary school, we were not offered, nor were we granted, high school gym or cafeteria space to host this. And we haven't for the 4 years we ran it, or the 3 years we've ran it, so I'll see next year, if this program still exists, I'll see if we can do it in the high school cafeteria, but if we have multiple clinics, I'm not gonna move them different places. They have to, the one thing. we
They're gonna
got is
be where
they have
they're
to
gonna
stay
be.
in spots.
But we're gonna try to draw people to us. That's the whole point. Because in the first several years we did this senior expo, we did do the flu shots. We did them in the cafeteria
Mhm.
and the place was packed. So
I will.
it's something to look forward to.
There will be at the very least, public health, like the Public Nursing Funded Visiting Nurses Association will be there. Regardless, that's covered under our contract. I can't promise, I can't promise the state program is gonna be running next year, but I'll definitely investigate getting that moved, doing that in the high school cafeteria. If nothing else, you will have COVID and flu with the VNA.
Fine. If nothing else, if that doesn't run, then we just gotta get it where we are so we can drive people to us. So that was my only comment, having spent some time with them, setting them up down there and then doing a postmortem basically with them when I went down to help them back up.
I know they were expecting between 100 and 150 doses of flu.
They maybe had 20.
Yeah, I think they well underperformed on that. We did a follow-up with them afterwards, and they were letting us know the numbers and that they were gonna try and do some other satellite clinics to move the vaccine that they have.
Yeah. So because it only lasts so long once you open it.
Yeah, and I think these ones are all, we're storing their vaccine right now in our vaccine fridges and freezers. I think these ones they're only ever good for a season because they're all
Yeah.
formulated for that season's variants, but we'll probably move all of them, but I think first year back, you had some hesitance, then we had 3 or 4 events stacked up that had flu vaccinations.
Yeah.
And then we didn't have COVID, so it wasn't a one-stop shop. So for planning next year, I'll see where we're at with that when we start the planning process. And if we're gonna do the state clinics this year, I'll speak with facilities at the high school, facilities at the school system to see if we can do it in the high school instead of the elementary school.
Okay. I just thought it would be a good draw like it used to be.
It definitely would.
Because we used to get 200 people.
It would help. It would definitely help. I think personally, my comment on the whole process is I think that there was ambiguity as to this and the hospital health fair.
Yeah.
I had people
I'm
asking
sure.
me questions about both and not differentiating between them. And that there were 3 healthcare providing events over the course of about 3 weeks between the not optimal clinic that we ran at the elementary school 2 weeks beforehand. There was the health expo. There were like 2 other, I think there were 2 other flu clinics done that were like semi-public ones.
Mm,
So we may either move when the clinic is in the course of the year or separate it out a little bit from the
Before the-
hospital expo.
Well, we got time to consider that in the spring, because you should have a better idea of that, but it was just something that we should sort of pursue.
And I won't be able to confirm what the state vaccination team is doing until the fall of 25. That's when they announced the program. And I'm curious to see if it'll happen this year. It was already it felt like there was less funding available for it this year than the previous year. So I'm not sure if it's continuing. And if that's the case, then we'll spin up our own clinics locally.
Okay. Cool, and otherwise, there were just some people missing that should have been there. They never responded to Laura, like the funeral home, because he was at almost all of them before that, especially when Ricky closed down. Lawrence was here
right.
every time, so people could have a
They
conversation,
must assume they're just gonna get the business that they're gonna get.
because they're the only provider, but it was very helpful for people to have a conversation about prepayment and things like that, because both my father and my mother, we had them prepaid years before they passed away in their 90s. So there are various programs for that. The veterans are different because my father was a veteran, so there's information that he could partake, and a lot of people spoke to him when he was here last. So there's just some people that weren't here, that there was a little gap in some of the continuum services. But I think once we get up and running again, they know we're going again, because we hadn't done it in 5 years. That we'll get more people and we'll get more vendors coming, because they know that we're actually up and running again. So otherwise, it was pretty cool talking to all these guys. Interesting information.
We had very good vendor support, that's for sure, yeah. And Laura she's going to send out a thank you along with, we'd like your feedback, so we haven't gotten the official feedback from vendors yet.
Right, because we need that.
Yeah, we need that.
Cool.
Anybody else have any more comments about the senior expo? I know, Erin, you weren't able to attend our debriefing meeting, but you had suggested that we be more careful about separating vendors who are in the same business, so we'll have to be sensitive to that in the future.
Yeah, that would be nice. There were 3 home care agencies, one after the
Yeah.
other. So once an attendee spoke to one, they didn't really care to speak to the other tables because it was similar service. And then not to say that this would be a good idea, but I'm just thinking, like, would we ever look at doing it at a different time of year where it's more
Yes.
spread out from the hospital health fair?
I thought about it before. It's always been in the fall. It is, whether it
It
was
has always
September,
been, yeah,
always been in.
usually October.
Yeah.
It would be nice if we could get real support from the hospital, serious participation and get them to suggest to people that they also attend our event. We'll have to work on
I
that.
don't think that that you'll have a lot of luck with that if it's the
Yeah.
same season. Like there's a sort of zero sum idea behind attendance on that. A spring one might potentially be interesting, but yeah, like
Yeah.
what's the
There was
draw
no
for the
weekend
spring?
available in April, May, or June, because there's multiple things going on in April, May, and June. The reason why it was always in October, usually the 3rd week,
There was nothing.
was because that was the one weekend after Columbus Day where there was absolutely nothing going on, and a lot of the snowbirds are actually still here. If we can't do it in April, you got school vacation, schools closed, you can't do it in May because there's something almost every single May weekend, then you get into Memorial Day. Then you get into June and people are like,
Yeah, you can't
they're
do
out, they're
anything
flat
in the
out.
summertime.
Yeah.
You can't do any major event planning in the summertime
Right.
because everything is full and everything
Yeah.
is 10 times more difficult to do.
It just happened to be that off weekend type of thing.
There's there's possibilities, there's a couple of plans in motion for and I think I think the branding is at local, which is a series of cultural events on the island in the off season. That could be that could be like the event on which this piggybacks, if it's done in the spring or in the fall, but I don't have Laura coming.
Is that a Chamber of Commerce?
It's culture. and tourism.
Visitor Services,
Yeah.
Chamber of Commerce, those guys and those, their guidebooks, 'cause I used to work on it, comes out in like January kind of thing.
Yeah,
So they go after all their members and they figure out what's happening, and then up really last minute stuff is at the Visitor Services. And then their websites post things, but I know having to find weekends for other things in April, May and June, it's virtually impossible. The
Yeah.
wine festival, the film festival, that, this.
it could be, I mean, the only time it's free is like before Daffodil, and I don't know if Island.
Well, then you run into Easter.
Well, and Easter, plus I think a ton of people who might be interested in this haven't returned.
Not back yet.
So,
So that's why it's usually October. But and then September,
Embers is still.
We had talked about, it was good having it after Columbus Day / Indigenous Peoples' Day,
Yeah.
because that was out of the way as well.
right?
And there wasn't anything.
It was
really.
just a beautiful weekend.
Oh,
You know,
oh my
and the
God.
Tide was
70
perfect for
degrees.
scalloping, and there was so many other things, you know, it's just that beautiful a day, and then I think there was a game or something
Yeah.
also. So there were like so many factors
There was a soccer
also,
game.
that soccer game,
Yeah.
yeah, so I think people were just sort of drawn outside, like, cause it was late in the season, like, oh, it's so nice.
I mean, I was standing in a parking lot all day and enjoying myself.
Yeah.
It was phenomenal.
Yeah, wasn't that amazing? I walked over from the other.
But my friend was the Lavender Farm, and he, I don't think had been before, cause you said you hadn't done it in a while, and his business is probably fine, and he really enjoyed himself.
And he did-
Well,
and he had
he was
an
a
endless,
big draw.
he had an endless stream of people going into that
Yeah,
chair.
he is pretty talented, but he's also on the board of the chamber now,
He's
so
massaged
getting
and
vendors
stuff.
that
He's
are
over
then
here
gonna
on
bring
West
that
Street.
message back, you know what I mean? It's just good because he runs a great business and
Yeah.
he's on the chamber board, so I think. To your point, increasing some of these vendors will increase the exposure
Yeah.
to the event.
Yeah, people
So-
were crazy about it.
Yeah,
Massager.
he's awesome.
So maybe when we
That's
do
great.
the advertising, because Arlene we had a long discussion about where to position ourselves and what venue to get people the word out. But we should put down some of the vendors that are gonna be there, because when you do that, because we do that for December Delight. I got a TV, I got a bike, I got a this.
All of
that's
the
my
vendors,
other
Kendra, were
moment.
listed on the CA website.
Yeah, but if we're doing a poster. Like we do for December Delight, we do post it everywhere, but if we do actual posters and stuff. And I can send it out through my websites and stuff.
Well, we
Now,
did have a
Lavender Farms is a
poster.
big draw,
Arlene did do a poster.
I think that
but I
like,
think more specifically, what types of things are gonna be there.
well, it's a redo of an older event, but it's not the same event. So
Right.
I think you're gonna have to do a couple of them to figure out what the ideal draw is. And I think that like, if we can lock the Lavender Farm guys in, that seems to have been a pretty
And
solid.
hearing tests and the flu
Yeah.
shots, and those things are things that people are like, oh, I'm coming. And the speakers,
Those were
Oh,
all
and-
on the posters. Everything you just said was on the posters.
but there has to be a way of maybe positioning it so they're like,
I mean, I think that there's always gonna be some fine tuning
yeah,
on how it goes, but like for a essentially restarted event. In a crowded season, 100 people is actually pretty
Pretty good.
solid. Like
And
it wasn't to
particularly for a
expectation.
new event that is, well, it's not new, but it's the return of event.
right.
And once it has its stick factor, your numbers are gonna increase naturally.
Cause they're gonna know we're coming back, you know, once we get into this annual thing again, cause we did increase the last one we ran without getting involved with the hospital, we had over 200 people. I think it was 205
Yeah.
people.
Yeah,
And that
that's
was
why I
great.
was
They were just,
expecting 200.
they were just packing themselves in there.
Do we
which is
know what
great.
attendance was at the health expo the hospital did?
Well, the first year it was it was off the charts because the hospital was brand new and everybody
Wanted to see the
it.
hospital and hear
So
them
the place
talking
was
beyond.
packed. And it was our event, both floors were used, I mean, it was a huge crowd. Then came COVID, everything changed.
Yes.
And then the hospital got less interested, so. It went downhill from there.
Yeah, so we can sort of pick up where they leave off, kind of thing. So I think we did a great job. Everybody did a great job.
Considering, I
Yeah.
think, yeah. This came off with very well.
Only broke one table.
Things are trending up.
Before we leave this topic, just want to make sure nobody else wants to add anything. Okay, the next thing on the agenda is you, Jericho.
All right, human services updates. This is gonna be expanded to health and human services updates. Just because, we've been getting an enormous amount of, calls and attempts to register short-term rentals. I know,
Does anybody know what's happening?
so the registration date has been delayed.
Again.
It's starting at November 8th because the reg was written ambiguously so that the reg was not, when the November date referred to in the reg was ambiguous as to whether it was 2023 or 2024
Or twenty
or
twenty-five?
2025. So the end of the due date for registration for next year is currently the end of this year. We're working with GovOS, who's the vendor, to improve the front end. It was a hastily designed system that is not working as well as it was
Well, then
anticipated.
they gotta put the deadline again.
Well, the deadline's been extended, so that's already done. And there's nothing stopping anyone from getting a short-term rental registered. Just everyone thought they needed to get their paperwork in at November 1st, and they do not.
And I'm in real estate, we've given them plenty of time, and all the offices have written to the owners multiple times, there's nothing tricky about it. You're
Well,
all
there's
registered with
private
the
people
state.
That
Yeah.
don't work through you guys, which like was my brother.
Well, so
Well, I mean, they should know, I don't know.
He
I
knew nothing.
very much do not wanna expand the short-term rental debate any further
Yeah, I
than the
agree.
deadline is
Yeah.
extended. to the
People that have
end.
already signed up are good through 2025 is what we were
believe-
told.
yes.
So if you've already signed up, then you're good until the end of next year.
Yes,
It's ridiculous.
So that's fine.
it is. There's a lot
It's
of,
just been handled so poorly right from the beginning.
it's not an easy thing to implement, and it was not done well initially. And once you start doing something poorly, it becomes much harder to make it better.
Yeah.
So aside from that, we have ceased our vaccine operations for the year. There'll be maybe some homebound deliveries for people that we've identified previously. There may still be hospital clinics. I think they were running them early into November for COVID, but as of right now, Health and Human Services is done with primary vaccinations. I'm sorry, not primary vaccinations, done with seasonal booster shots for vaccines. We will be investigating if that program starts next year. We're gonna do it right again. We'll have at least 2 or 3 clinics. That's intended to be an ongoing thing that the health department
That
does.
includes COVID,
Yeah, it'll always be COVID and flu for us.
RSV,
RSV is under.
Dan has it.
Yeah, but the state doesn't have it. The state doesn't have it under the public vaccine program, the Massachusetts Vaccine Control System and MVCS. I'm sorry, MCVS. The Commonwealth Vaccination Service does not have RSV right now. The RSV vaccine candidates are not covered under the federal program that provides drugs to Massachusetts, which then trickles down to us.
It's on the rise
It
with
is,
people our age. It's on
It
the
is.
rise. And
but
it's devastating.
that's something that gets ironed out at the federal HHS level, and I have less than no say on. The next thing is, and this is relevant to Linda as well as everybody else here, we have collected the due date for the contract review committee's local town grant process. We had a grant cycle that started in about a month ago. We've just collected the last applicants. We'll be doing some deliberations and announcing our recommendations for local funding. Probably by the end of December, or sorry, by mid-January. We just sketched out a list we'll talk about on Friday. That's $650,000 of local town money for human service needs. And this year it's $175,000 for substance misuse. We'll be announcing those again, end of summer, early fall next year. If you have nonprofits that you think do human services for the people of Nantucket, you should reach out to me and I'll show you where the regs for signing up are for next year.
So, Question, are any of those that have applied, senior oriented?
We have applications from 3 agencies, I believe, that are doing senior focused service delivery. It's the Netican Community School in Sherburne Commons with a memory cafe program that they were funded for last year. Elder Services of Cape Cod and the Islands came in with their congregate lunch and Meals on Wheels
Wheels,
program.
yeah.
And then, I think one of the use cases for, or one of the requests for one of them was senior facing behavioral health. But I'm, 250 pages deep into reading grant applications and I can't remember which one's which right now.
Okay.
What time is our meeting Friday?
9
Here,
here.
'cause I have dental surgery at 11.
We should be wrapped up by then.
Okay.
Do be in there, cause that's when we're assigning who gets what. Then, what else we got? We've been working with Rocky on, sorry, not our Rocky, but Rocky Miramontes, Director of the Health Department. We've been expanding some, tick-borne illness related things, tick-borne illness related research and outreach plans. I also attended the single most interesting meeting I have ever attended as a town employee, which was a deer contraception meeting.
I've seen that before.
Yes.
We've tried that before here.
We
It
were
didn't
talking
work
about.
here the last time.
So this was I've never seen a meeting like this where someone from state showed up and at the beginning of the meeting just said, so if this won't work for A, B, C, and D, where
Yeah.
D is I issue the permits and I will not permit this. It was a beautiful meeting. It somehow went from that in the first 5 minutes to a healthy and productive work group. So it was a very interesting meeting. But basically we got some hard numbers on the deer population on the island. I've been working with Dr. Sam Telford and Joanna Buchthal, I believe, who have been doing a bunch of work on the life cycle of the Lyme disease carrying tick. We also have had discussions about the numbers and spread of Lone Star disease on the island. And we're gonna start doing some messaging to healthcare practitioners on the island to try and get a primary diagnosis on a tick-borne illness instead of just doing the doxy cycle. And then we're also looking at both disease reporting and the potentially pharmacy usage rates, to try and determine prevalence of tick-borne illness with an eye to introducing new mitigation strategies. We're gonna try and do some education around landscape design on the island because you can impact the amount of ticks on a particular site with how you design the landscape. And then we're gonna start having some discussions with the state arbovirus surveillance program to monitor both tick and mosquitoes for various tick vector-based disease. So that's gonna be my mini project going into the summer, is to try and get something workable out under that.
So how many deer are there on the island?
So I have,
More per square mile than anywhere else in the state.
this is almost certainly correct.
Yeah.
How many did you
I
say?
have,
Well, it's more per square mile than anywhere else in the state.
so
That I believe.
I have never seen
How about square foot?
so I've never seen a scientist give this definitive of an answer on anything in my entire life. The guy went, he showed the work, and then he's like, there are no fewer than 10,000 deer on Nantucket.
Yeah, there's no natural predator to kill them off. And they've hunting season's 2 weeks now,
So,
but that's not long enough. They tried one, if you remember, in February 1 year.
004 is the one you're thinking.
Yeah, and
They're
then
actually
they said, oh my God, you're killing Bambi. I can come sit
Well,
on my
this isn't
porch and
about
kill every
killing,
single
this is
one of.
about, contraception, right?
Well, so what the scientist said is that the only way contraception works is if you have mortality in your deer herd.
Yeah.
The only thing that kills deer on Nantucket is car strikes and old age. So
Yeah.
basically, back of the envelope
Or getting
numbers.
shot.
So this was a darting program where they would be darting them with a thing called PZP, which is a hormone that sterilizes for 2 to 3 years. We'd have to do that to
Oh my
80% of the deer population on a yearly basis for 3 to 5 years to the tune of $10 to $15 million a year.
Oh
Just
my
give
God.
us one of those guns.
Well, just give me another goddamn hunting season.
So they are extending primitive firearm season this
Yeah,
year.
but that doesn't.
That's only a
show
month.
here.
My son used to do that, and then he did bow and arrow.
They're
And you're
doing,
not just shooting one every 5 minutes. You can
They're-
come sit on my porch and get the entire herd out of my
so one of
backyard.
the things they're dealing with is that they're doing messaging. They're trying to not have a repeat of the 04 hunting season where it was a nightmare for everyone.
Nightmare.
Literally at this meeting, he mentioned something about extending the hunting season. He's like, it won't be like 04 before anyone else could say anything.
Yeah,
But they're restricted because a lot of the hunting laws are set by state law and their statute limitations, not regulatory ones.
Right.
And they would need to have a article pass through on a general election day, like we had the 5 this year, the general questions, I forget what they're called.
what they can
Ballot
also do
initiatives.
is increase the amount of doe permits,
Um,
because the doe permits are limited. And
those-
the
that
doe
was one of the
permits
things-
is a problem.
That was one of the
not
things
having
discussed.
enough.
There's also gonna be a month-long.
Sorry, guys, this is not really COA related. Can we get back
Excellent.
on?
It's not.
Yeah, good point. Thank you. Sorry,
'em
like
all.
I said, this was the most interesting meeting I've been to, so I kind of like talking about it, but you are dead on correct.
Yeah,
Arlene. Apologies.
just shoot them all.
That there will be some tick-borne illness related stuff and discussions of expanded hunting season coming up. I think that's basically my major points. If anyone has a question on anything going on with the town and they want to ask me about it now or via email is entirely okay, and I'm good. Sorry.
Okay. Is Laura next?
Laura is next, but she has sent us her report, and
Yeah.
so Laura usually asks for anybody who has any questions or comments on your report. I don't know if you want to add anything to that. No?
Hi,
No,
Fran.
just any
Right.
questions or anything?
No, good
Okay.
report as usual.
Yes, thanks for your report in advance. That's very helpful.
You're welcome.
Robert, you're on our agenda for the next 2 items. I don't know if you have.
Which one would you like first?
The first one, your NHA presentations from which you just came.
We just came, we were at Landmark today and Salt Marsh yesterday. And the topic for this month is the old mill and the restoration of
restoration.
the old mill.
That's my project.
And then we have extended invitations to the seniors to have tours of the Festival of Wreaths and the Festival of Trees. And if transportation is a problem, we have transportation vouchers to help the seniors come.
Great.
And we're already lining up the spring programs, starting in January. And then we just finished last week on the road overseas, and we were at 6, I know you laughed every time.
Every time.
We were at 6 senior centers on the Cape and talked to over 190 seniors over there.
Wow,
That's really great.
Yeah,
that's great.
And we are
Impressive.
in talks to expand the program on the Cape.
Cool.
terrific.
That's cool.
Any questions for Robert or comments on what's going on at the NHA with seniors?
No, I love that. You're gonna get them, because everyone loves those trees, and if they can't get, I love that. That's so great. 'cause-
Well,
Keep in
I was
mind-
talking to Stacy Stewart and warned her, not warned her, but advised her that we were gonna have seniors. So, because we have to cram all of the trees and wreaths
Into the
in,
Hall of the
we
Well.
have to make sure that there is room for wheelchairs
Yeah.
to
Wow.
navigate.
Cause they've got stuff going on in the other venues, there were the trees and the
Yeah.
wreaths are usually all upstairs and
Yeah.
all over the place, but the candle factory, 'cause that's my project also, is the back wall. And they're doing a lot of stuff, so the only place to put all this stuff is where the whale is in there. And you know, it's already kind of cramped in there,
Right.
so now there's less trees, less wreaths, but they're all in there. Cause we're doing a tree with Kathy, and so, or a door that looks like a tree. But it's gonna be interesting, everybody's in that one place.
And then Elder Services is launching a fundraiser in spring called Spring for a Meal. And restaurants are being contacted on the Cape, and I'm working with Sherry Hunt to pick 1 or 2 restaurants on Nantucket, and there would be a card in the restaurant where you could just QR code it, and you could buy a meal for Meals on Wheels.
That's great.
Wow, that's awesome.
I love that.
So it's called, you'll see it, it's gonna be in spring, called Spring for a Meal.
That's great.
And will it just
And
be
if-
in the restaurants, or will there be like, you know,
Shop
notices
and
that like
Right
advertise?
now, it's just, it'll be advertised by Elder Services, but right now, they're just gonna do restaurants.
No, right, but Elder Services will advertise it, like I was just thinking, what about like all our summer visitors and someone goes to it, like.
Well, it's only going to be for a week in spring, and that's it. Just to see what it is.
See if it-
And there'll be
see if it
10
grows.
cards in the restaurant,
That's
so
great,
you just shoot it and you can buy a meal.
that's great,
It's wonderful,
So I am meeting with Sherry tomorrow.
great.
except that I have a flip phone.
Oh.
Good idea.
So that's what's going on. Plus, the offices are all being renovated in Dennis.
Oh,
The whole building is, because it's so cramped and just, it's pretty gruesome working conditions.
Cool.
anybody have comments or questions for Robert about Elder Services of Cape Cod and the Islands? Okay, thanks, Robert. Great news. Yeah, thank you.
So look for spring for a meal.
Yeah.
I think that's a great idea.
Yeah, Sherry mentioned something about that the other day.
Yeah.
I'd love to see that get expanded, like I like when there are programs where you can like do something immediately and then it has like a positive feedback effect or something like that. Cause that's one that's easy to explain. It's like, well, I'm eating and I could buy a meal for someone
Make a
else.
meal for somebody else.
And
See,
then they are really behind the 8 ball when it comes to food costs for elder services.
oh,
Going up.
that's horrendous.
It's going up.
30% increase from
Yeah.
this time last year total for them. And it has been an issue for them to secure driving staff to get meals delivered to both the Salt Marsh and other places.
Yeah.
And everybody who cares about this program, it's all thanks to Kitty Murtaugh, who's doing the food for them and giving really good rates on
He's,
that.
he's not making any money, I
No,
know,
he's-
'cause I do a
he's-
lot of work for him,
he's like-
but it's,
he's making-
his costs have gone up and his costs on his staff have gone up to make the meals, as many meals. But he's really
They
dedicated
do
to
a
this.
fantastic
Oh,
job.
the food is terrific.
Yeah, I served lunch on Wednesday, so I was there today and we had 20 people for lunch and it's buzzing there and the food was fantastic and the people are so happy to be there and have a chance to socialize, eat a good, I mean, it was a really popular meal today, so everybody was happy. And 2 desserts, so that helped
Oh,
too.
wow.
But it's a great program, the Congregate Lunch, as is the Meals on Wheels program, yeah. Okay. We've come to the end of the agenda, but there's one bit of other business I want to mention, and that is that Arlene, who is overwhelmed from many different directions these
Mhm.
days, has said that she would like to retire as our secretary, and I completely understand that. Thank you, you've been incredible. But this is gonna require us to have an election at the next meeting. So I want to say thank you to Arlene. I'm glad that you said when when you've had too much, it's time to say so.
Didn't we elect her when she wasn't at a meeting?
Yeah, oh yeah, oh yeah, I'm voluntold that she was
No,
gonna do it.
Linda, I actually volunteered when I first joined the board, so, yeah. but it's been
Thank you,
years
thank you.
now, so I think I'm good, but thank you.
Yeah.
Thank you, and I just want everybody to know, so at our next meeting, we're going to have an election, so be thinking about, would you like to volunteer, or would you like to volunteer somebody else to be our secretary?
Who's gonna be not at that meeting? We'll get that.
That's whoever's not at the meeting.
Well, me.
We'll get them.
We're gonna have 100% attendance now. It's gonna be fantastic.
I'll make a motion to adjourn.
I'll second it.
Okay, I guess I have to go down the list.
Oh, yeah,
again.
yeah.
So this is to adjourn. Robert,
Aye. Yes,
Aaron?
whatever you say.
Yes.
Arlene,
Yes.
Arlene, Lisa,
Yes.
Linda,
Yeah.
Marion, yes. Thank
Thank
you,
you.
everybody. Appreciate your being
Thank you.
here. See you next month.